Welcome to the Mental Health Hub. I would want to appreciate you for being able to subscribe, to like, as well as share the previous episodes that I have hosted. Thank you for being my family in this platform. And thank you for the comments and even the questions that we have been able to respond. There has been a learning opportunity, and I hope for more interactions so that then we can grow this network as it is the aim of this platform, to be able to grow a community that understands, or at least is able to speak about mental health, so that then we create more awareness. And with more awareness, then interventions are put in place for the good of the individuals, the family, and the community. As we continue to learn, I want to put this across to us, the importance of making mental health interventions a professional responsibility. In this sense, that as we have discovered, mental disorders or mental illnesses are many, classified in various categories, which we have learned before, and we still also continue to share, to explore more and learn. And having seen that, then, with all these many types of mental disorders, it is important to be able to get the correct diagnosis, so that then a person or an individual is treated for the correct illness that they have. How then are we able to do this? Is being able to understand and appreciate the fact that these are sicknesses, generally speaking. And as WHO are saying, they are disorders. They are diseases, just like any other disease. And therefore, a disease, for it to be treated or managed well, we need to be able to establish what it is exactly, so that then the treatment can be done. And who is better placed to do this? A professional. And that's why I want to emphasize today the importance of making it our responsibility to reach out to professionals for help. We have seen a thin line between one mental disorder and another. We have seen the importance of early interventions, so that then the disorder is treated when it is either mild, before it develops to be a moderate, or even a severe disorder that will be quite delicate and quite demanding to deal with. So then a professional is very, very important. We need to be able to professionalize, or to be able to reach out to the correct professionals, to the correct person who can be able to identify or diagnose, and therefore give the correct course of treatment for one mental disorder or another. As I have said, and as we have learned here before, there are many mental disorders, and correct identification of which disease, the disease or the disorder that one has, will pave a way for the type of treatment. Because as we have said before, treatment for mental disorders can be by medicine, or providing medicine. It can be physiotherapy. It can be psychotherapy. It can also be a combination of several approaches for management. Therefore, for us to be able to pave this way, then it is going to establish the correct or correctly what disorder one is manifesting with. We learned about the signs and symptoms. The professional will be able to look at the signs and symptoms and identify finally what it is that this individual is suffering from. And therefore, we bring in psychiatrists, we bring psychologists, we bring counselors, we bring even social workers to be able to tell us, even looking at the causes or the underlying issues, so that then we can be able to get to professionalize this. Why is it important that we make it professional? because as we have seen before, mental disorders really is not like you can be able to see physically, so to speak, the condition that this person is having. You only look at the signs and the symptoms. And then, if these signs and symptoms have to be properly followed to give a link to which of these disorders that this disorder that this person is manifesting, then we need a professional. What I'm saying is that we need to stop self-diagnosis or diagnosis of another person, where you are looking at what somebody is thinking, or the feelings they have expressed for a period, or the behavior of this person, and saying this person is mad. No, it is not about madness. It's not about madness as society calls it. It's a disorder that requires proper diagnosis. And who is better placed to tell this? It's not you as a family member. It's not you as a friend. It is not you as a fellow worker with this person, but the professional that is properly trained to be able to identify a mental disorder, so that then they can be able to give the proper management strategy for the mental disorder. So I would want to insist that self-diagnosis, we should not self-diagnose. We should not be able to, even as a family, even as we said, that we have a responsibility to be able to help begin the interventions on realizing that one is not well. We have a responsibility to be able to see that this person goes to the correct professional for diagnosis. As I had indicated earlier, there are so many people who are being treated for physical illnesses, and yet what really they are having is mental disorders that have not been detected. Therefore, you find one is being treated for the wrong condition, and therefore they are on medication for a long time. There's a lot of suffering, there's a lot of expenditure even for treatment, and yet if a correct diagnosis was done, this person will be treated, or they will be able to identify what is this health condition, what is this mental disorder that the person is having, and therefore they will be managed in the correct way. So emphasis for today is that correct treatment is dependent on the correct diagnosis, and correct diagnosis will be dependent on getting to the correct professional, a person who has been trained to treat mental disorders. And these are majorly psychiatrists, psychologists, counselors, because they are professionally trained to look, to identify and also manage. And they will also be able to work with the patient or with the client over the course of management of the condition that one is being treated for. So I emphasize that let it be our responsibility to actually work with the professionals. You see, in society, you'll find because of a weird behavior, people will discriminate. People at times will stigmatize this person. And why is the stigma there? Because people don't know exactly what is happening. You are not able to tell, why is this person behaving the way they are behaving? Why is this person withdrawing? Why is this person always sad? Why are their moods not understood? Today they are like this, tomorrow like this. Even this person themselves, or even the person who is sick, doesn't understand what is really happening to them. For correct treatment and proper understanding of the condition, then the professionals will come in. So I urge us as family, as society, as individuals, in the midst of it, let us be able to tell ourselves that it is important that we get professionals to deal with the mental conditions. so that we can be able to help one another and alleviate the suffering that many people are going through because of wrong diagnosis, either self or even family. And then, today people have gotten used to over-the-counter medication. Most of treatments or medicine, even that are given for mental disorders, are not over the counter. They need to be prescribed. But you find somebody has some signs or some symptoms that they tell themselves today, hey, the way I'm feeling, I need something to help my mood. I need something that will calm me down. You find some people even resorting to substance use so that either they can calm down or they can feel happy, and that kind of medication of the condition or taking substances to calm down or to be excited is actually wrong diagnosis. You need to be able to get the correct reason why your mood is fluctuating, why you are feeling sad, why you feel you don't want to talk to anyone, why recently you have become so irritable, why it is not possible even, or you don't feel like waking up, you don't feel like doing what you are used to do normally, or you observe that of late even your appetite has gone down, or you're overeating, or all these signs and symptoms that we mentioned, or these indicators of mental health disorders. When this is prevalent, then it is important for proper professionals or a professional to be able to help us identify. Why do I emphasize this? You find in the society, really, the issue of mental disorders is kind of a recent situation where people are now appreciating, really, this is a sickness, this is a disease. So unless we allow ourselves or society awareness is raised to an extent that we don't take the misconceptions and the myths that surround mental health and therefore start treating or mismanaging mental health with our traditional ways of doing it, where you say this person needs to be maybe locked up somewhere because they're having a weird behavior, they are embarrassing us when we are visitors, they are kind of talking to themselves, they are seeing things, you see them running because of either, they run away from people because they think somebody is chasing them, hallucinations of one form or another, undue hallucinations where somebody is hearing voices, or where somebody is seeing people chasing them, or somebody is tasting things that do not exist. So all these at times cause some kind of confusion. And to be sure that we are dealing with the correct condition, that's why we need to have professionals come in place. Of course, even as it is, we have very few professionals who are trained for this. But even the few that we have, we need to be able to raise awareness to the community to an extent that we know that they are counselors, we know that they are psychologists, we know that they are psychiatrists. So as a society, as a people, I want to use this platform to tell us that it is important that we reach out for help, and reach out for help from the correct persons, so that when you have a correct diagnosis, then management becomes easier, so that the professional will be able to advise, are we going to use medicine to deal with this condition? Does it require counseling, or does it even require both? Does it require this person being supported by family? It brings out the continuum of care, so that when the correct care is given, then we are safer. Why is it also important? So that then the other people who are important to be the support mechanism for this person, or they could even like look at a condition like trauma. This child or this person, it has been identified that they are post-traumatic stress disorder. And probably the home ground or the home where they are coming from, there are items or there are situations that trigger this. So a professional will be able to listen to this person and be able to tell that at the family level, there are some interventions that need to be taken care of. Why? Because treatment is not about the identified client alone or the identified patient alone. When it comes to mental health, even the family comes into play. You know, for physical illnesses, when I am taking medicine, my child doesn't need to take medicine because they are not the ones who are sick. I am the one who is sick, for example. But in mental illnesses, with mental disorders, my mental disorder will affect relationship at family level, will affect relationship at the community level, will affect relationships at the workplace. Or the relationships at the workplace, the relationships at the family will affect my mental disorder. That's how important it is for us to seek out professionals so that they can be able to help us understand that it's not about me, the identified patient alone. It is about the community from which I come. It is about the people with whom I live. It is about the situations that surround me, including the environment from which I come or which I interact with on a daily basis. It's also very important to bring in professionals because treatment of mental disorders is rather lengthy. And with a lengthy treatment, then it means also the resources that are needed may be more than if you are treating a physical disorder or a physical sickness, that will maybe take 3 weeks to heal. That will take taking a tablet in the morning, in the afternoon, and in the evening. 1 times 3, 1 times 4. And therefore, as this person is taking their medicine, they are healing. And it doesn't matter who is around them. But with mental illnesses, the people surrounding you matter. The costs may be prohibitive for you alone. And therefore, the other people come into play so that they can also support you to walk this journey with a chronic disease that requires support in terms of even being reminded to take your medicine, being reminded to go for therapy, especially knowing that the person who has a disorder may oftentimes not tell when they need to seek help. They may not tell when they are getting very irritable, when they are getting very moody. So they need this other significant person to be able to identify, oh, it's not well. It is time now to go and seek a counselor. It's time now to go back for treatment. It's time now to go back for your medication. So it's not about this identified patient alone. So I emphasize the importance of seeking professional support. And having said that, also say this, that it is important to stop self-diagnosis. It's not like you can walk over the counter and buy a tablet. So if this is the case, then it is important to ensure that you're not self-diagnosing. When all these signs and symptoms manifest, please let us try and seek professional help so that the person can be supported, so that you can be supported for proper diagnosis, for proper management, for better help for this person and the community or the people with whom you live. Because as it is, a mental disorder doesn't only affect the identified person. We all are a part and parcel of this person, and we need to be able to help them manage the condition, even to better the lives of the person and to better the lives of the people with whom they relate, with whom they live. Therefore, I emphasize we need to professionalize treatment or management for mental health disorders. Thank you. I look forward to the next episode, and I want to say, let us continue this opportunity to learn, this opportunity to interact, and I welcome your comments, I welcome your questions, I welcome an opportunity to share more and learn more to create this network of informed people, so that then our society can be able to respond to issues mental health in a better way. Thank you.